So first I'll start with the summary. Medify is a comprehensive healthcare platform that revolutionizes how patients manage their medical information and interact with healthcare providers. It mainly addresses the critical challenge of medical record fragmentation by creating a unified, secure, and intelligent system for storing, managing, and sharing health data between patients and healthcare providers. So first I'll dive into the app. First I have to create an account. So as it shows username as a unique ID. So every user have to have a unique ID. So here I have logged in. This is what the main dashboard looks like. Here it's the main my health thing where you can have an overview of your health, medications, your reports, basically everything. So this is the prescriptions tab, report history, medications. You also have an insurance manager. So let me add my insurance policy over here. See, I can save this policy. So it's safe for now. This is a health planner and this is a carebot chart. So let's start with a demo. I'll upload a report. So let's first add a medical report and let it analyze. Till then, let's create an account for doctor. Okay, so this is a doctor's dashboard. This one is basic. The doctor also has clinical reference assistant where the doctor can ask for past cases, citations, or any support that the doctor needs. So here, as we can see, it has extracted the date of report, patient's name, doctor name, the specialty of the doctor, what are the diagnosis, medications. So there always can be issue while parsing the document. I have given an option to correct it. Here the user can correct it. It has uh, correctly found the frequency. So I'll verify and save these details. So after verifying, it will automatically refine the summary based on the corrections that the user has done. As I have changed the name of this drug, so it will make it Retiva over here in the summary. Let's add an lab report also. So here we can analyze a lab report. Till then, I'll show you here the doctor can add a new patient access. So for safety, as doctors should not be able to access any user's records without the user's information or permission, I've added a feature that the doctor has to punch a request to the patient, and whenever the patient approves the request, then only doctor can access it. So this is the report's finding. This one is a correct finding that was done over here. So I'll verify these details. Yeah, so here in the report history, you can see these two reports are segregated. Medical docs has the medical dog, lab reports has the lab reports. Then in the medications, as you can see, it has calculated the number of days that were given earlier to the user in the report. So it is a medical history which is of use for the doctor. Then over here in the My Health options, you can see the lab report and medical report. There you go, you have a notification. When you click on the notification, you can see there is a connection request from a doctor. You can approve or deny it. So I'll approve it. And then in the doctor's dashboard, you can see there is an active patient over here. So in the view reports, you can see these two reports in the patient's dashboard. Then there is an insurance status also that is visible to the doctor. Doctor cannot make any changes or addition or any deletion to the reports or anything. What the doctor can do is just give prescription and orders to the patient. So here the doctor can add anything like paracetamol 500 mgs 3x daily for, let's suppose, 12/12/2025 till 16th. Take after food. Prescribe medicine and a lab report saying, suppose, KFT, LFT, lipid profile. Instructions can be anything that the doctor wants, like check for any issues in kidney. Then you can see that the patient, in the prescription there are two active records, and the patient can mark it as complete, and he gets an option for 24 hours to undo it, because you can by mistake mark it as complete, so there is an option to undo it. And this one is logged to mark complete because this ends on 16th of December, so you cannot mark it complete before 16th of December. You have to take it after food. You can see all the description over here. Then here in the medication section, if the patient takes any medicine, then the patient can add it over here, like I'd say amoxicillin 200 mg daily. I was taking it, suppose, from 10th till 12th before bed. Save medication. So this is an anytime amoxicillin that is due today, because before bed hasn't been happened till now. It checks for the time. I can also check if amoxicillin is has any food interactions that can make it difficult for the user. So none known to significantly affect absorption. Amoxicillin can be taken with food to minimize potential gastrointestinal upset. So there is nothing which has to be taken care of. There is no drug to drug interactions, no food drug interactions. This one is a common side effect, so that patient doesn't get panicked or anything if he sees any normal side effects. And here the patient can also find the nearby hospitals that are available. So till then, let's see doctor's dashboard. Here the doctor can also see if anything was done. So like 18th of May, there was a report punched in the patient's dashboard, like the report dated on 18th of May. So here in the calendar, the doctor can see if any event is there. You can also, like, there is a list of hospitals that come under this health insurance policy, sorted according to the distance. You also have the option to edit the profile anytime. In the My Health section, there is an option to log vitals. If you save these vitals from day to day, there you go. 12th of December is marked as purple because a vital has been logged. Similarly, this thing will also be displayed over here. Vitals logged, as doctor can see what's happening in the patient's dashboard. Doctor can also delete the patient over here. If he removes, then the patient's gonna get removed. There is a CareBot chat that the patient can do. So let me speak to it. What are the side effects of an elevated creatinine in someone's body? See, so it detects what the person has spoken to the chatbot. So it's a basically conversational AI. I've built this using. So here you go. There are the side effects of an elevated creatinine in someone's body. Here it always provides a disclaimer that CareBot provides information, not medical diagnosis. So I have given an disclaimer over everywhere. Here in the health planner, you can see it records the medical conditions of the user that have been detected in the user's profile. You always have the option to edit it, because medical conditions can anytime change. So here let me upload my goals. So here I go. Till the time it's designing the plan, let's see what the clinical reference can do. So I'll ask him, cite me references for elevated creatinine in a gym goes body and their effects. So here you will see the plan has been generated. So the vegetarian plan is can be seen over here. So it shows the breakfast that has to be taken, how it has to be prepared, every calorie, how much protein it will give to the user. So it gives a three-time meal as shown by the user, how many meals the user take. Then there is an exercise routine according to the time the user can take in a day. So for 30 minutes, it properly accommodates everything like warm up for 5 minutes, main workout for 20 minutes, and then a cool down for 5 minutes. It also shows how the hydration and recovery should be done because sleep here it says it's a personalized plan. So here in the sleep you can see that it prioritizes sleep because of under eye concerns and hydration also because of elevated creatinine. So medical considerations are taken care of, avoiding creatinine supplements. And here I have given a disclaimer because this is an AI generated plan and there can be issues to it, but mostly I have tried to avoid the hallucinations that can be done and keep it as personalized as it can be to any user. Here you can see that here it has cited the references that have been due to elevated creatinine. Yeah, so this is all till now that I have created. There is an also an option that in the medications, if same medicines happen to be occurring in the same time slot, then it will not punch them. Yeah, so that's it. So the main problem statement that I'm dealing with is that patients have to physically carry and manage multiple medical documents, including lab reports, prescriptions, medical records, every time they visit a new healthcare provider. So what this thing leads to is that inconvenience of transporting paper documents, loss or misplacement of critical health information, incomplete medical history because of going to a new physician, or difficulty tracking medication interactions and dietary restrictions. And there is also limited coordination between healthcare providers because of the paperwork that the patient has to do. These were the core problems that I am dealing with. Secondary challenges are patients lack accessible resources to understand medical terminologies that are difficult to understand, and patient have to repeatedly ask any doctor. So I have given a chatbot for that. The chatbot cannot access the patient's dashboard or any report. So the chatbot cannot be used to attack any patient's profile, any cyber threat, as the reports have safety and are not exposed to the